Hello everyone, welcome to Psych Solutions, where we discuss ideas for increasing your contentment and quality of life. I'm Dr. Peak. I am a psychiatrist and addiction medicine specialist, and I'd like to start a discussion in this video about two types of stress, acute and chronic. This has been a challenging year for humanity. I've personally felt the tension, my patients have struggled, and I've listened to my friends and family deal with the changes and traumas in their lives over the past 12 months. We've all experienced both types of stress this past year. So what's the difference between the two? What are the evidence-based ways we can manage, and is there a way to develop some level of immunity to future stress? What can a person do today to feel better when life feels overwhelming? Acute stress is a here and now feeling of tension. Too much, too soon. A sudden loss of job, an illness, a worrisome email, a hurtful interaction, an unexpected bill. Chronic stress is long-term. Too much for too long, or too little for too long. Grief, parenting, a toxic relationship, financial strain, prolonged illness, abuse, neglect, all examples of chronic stress. It is important to identify which type of stress we are enduring in a given period of time because they are managed a bit differently. We cannot always control the stressor in our lives, but we do have influence over the experience of stress, which is simply how our bodies and minds interact with the thing or issue that is stressing us. Both types of stress can feel and be traumatic to a person, depending upon our genetics, our backgrounds, and environments. Over the past year, we've all been dealing with the usual baseline stress of living in this world, plus a timeline of one acute stress after another, on top of underlying chronic stress of navigating a pandemic, and however this has impacted each of our lives. Fortunately, most periods of stress and trauma do not develop into PTSD, or post-traumatic stress disorder, although PTSD is underdiagnosed by mental health professionals, because it is not only horrific and dramatic life events that can lead to trauma response. But the good news is that resilience can be learned. Acute and chronic stress, although potentially traumatic, can be managed, and we can immunize ourselves against the psychological impact. One of the first steps in the journey toward resilience is to tell someone how you feel. This may seem common sense and obvious, yet there are many barriers to expressing our internal world, the busyness of life, stigma, shame, and fear. But engagement and intentional empathy exchange is the foundation of resilience. Babies and children are quite good at this. Then somewhere along the path to adulthood, we forget or are taught to hide or repress our internal feelings and thoughts. When we are newborns and completely dependent upon our caregivers for survival, we instinctively know to express our feelings and needs long before we are verbal. We laugh, cry, and scream whenever we feel like it to signal to our caregivers that we are feeling something and require witnessing and attention. We are wired biologically to give and receive empathy to survive. As adults, the purpose of engaging in empathy exchange is not necessarily to fix or troubleshoot our stressors, but it is to open a space where one is witnessed, validated, heard, and loved. These needs in adults are primal in origin and continue throughout our life. We all need a few people in our life who provide this safe space for us. Choose these individuals wisely. They should be people you love and trust with no agenda, people who have historically proven they can listen without judgment. If you've not gone there with any of your friends or family before and it feels awkward, try making a direct ask. I'm going through some difficult times and I need someone to talk to. Would you listen for a bit? This is vulnerable, I get it, but vulnerability and empathy are human superpowers. Try and name what your acute and chronic stresses have been over the past year and talk about it. If you don't have anyone right now, try seeking out a therapist or psychiatrist or a local support group. Since finding a professional can take some time, consider journaling. Write down what is going on with you on paper, name the feelings. Even empathy exchange with yourself can have an impact. I try and open each session with patients by asking, so what is the GBU? This stands for good, bad, and ugly. The intention is to open the floor for the full spectrum of emotions and thoughts, even the ones they might label as ugly. So ask yourself, what is my GBU right now, and do my people know? I really look forward to sharing more interventions with you to build resilience and manage stress, look at evidence-based approaches, hear your feedback, and learn along with you. Thank you for watching.